My name is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. We're starting off this series talking a little bit about Medicare 101. We're going to dive deeper. We're going to talk about the industry. We're going to talk about the Medicare space changes. We're going to cover it all. But for the sake of simplicity, let's just start off with a little bit of Medicare 101, which I think will be really beneficial to people who aren't familiar with how Medicare works and what the process is for getting started. So I'm going to share my screen. We're going to do this a little differently. I'm going to write it out, very, very basic, so that you get an idea of what it covers, what it costs, and what your options are. So let's get started. So, welcome to my Medicare 101. And here we go. So, when you turn 65, you get something called an initial election period, which is a 7-month window. It starts 3 months before the month of your birthday, the month of your birthday, and 3 months following the month of your birthday. This is when you apply for Part A and Part B. There are situations where you can qualify for Medicare before the age of 65, typically due to disability. Now, for the sake of simplicity, we're just going to talk about 65. It's a big year. You're now eligible for Medicare Parts A and Part B. Like I mentioned, when you enroll, you will be signing up for Part A, which is your hospital insurance. Now, Part A is going to cover your inpatient care, stays at a skilled nursing facility, behavioral and mental health hospice. This is usually free if you have worked full-time for at least 10 years and contributed by way of taxes. Let's see, so just to make that clear, there's usually no premium. Now, there are situations where maybe you did not work full-time, and there are remedies to that, such as if you are married and your spouse has enough qualifying quarters. 40 qualifying quarters is basically 10 years of full-time. You can borrow from your spouse, but for the sake of simplicity, like I said, we're really just going to stick to the idea that you qualify for free premium free Part A. So like I mentioned, this will cover inpatient care if you were to be admitted to the hospital. What that really equates to is your room and board. It's not going to cover your doctor's visits. It's not going to cover surgery. It's not going to cover rehabilitative services. It's really just for the sake of staying in the hospital. And another important thing to note is that it does come with a yearly deductible, and in 2025 it is $16.76, which is what you will have to pay out of pocket before Part A covers your hospital stay. So it's free. There's no monthly premium, but there is a deductible. And we'll just make a note of that. Deductible. Going on, you're probably wondering what's going to cover your medical care. That, my friends, is going to be Part B. Now, and please forgive my sloppy writing. It's not easy writing on an iPad, I've learned. So, moving on, your medical care from Part B does come with a monthly premium. In 2025, it is the cost of $185 per month for most people. That is standard. If you are a high income earner, you'll be subject to something called IRMA, which we'll discuss later on. However, for the sake of simplicity, we're going to just say $185 per month. Now, what we refer to this, Part A and Part B only, is original, original Medicare. But you're not done here, because in order to avoid any late enrollment penalties, which we will also discuss later, you're going to need a prescription drug plan, also known as Part D. We're going to call that D for drugs, or as I like to write it, RX, prescription drugs. Typically, a standalone Part D plan is going to range anywhere between $0 and about $70, $75 per month, but national average has us at around $30 per month. Now, this is if you were to be in original Medicare with a standalone prescription drug plan. You're probably wondering, what else would I possibly need if it's covering my hospital and covering my medical and my prescription drugs? Not too bad if I only have to pay about $220 per month. Well, here's the issue with original Medicare, is that it really only covers 80% of your medical costs. And that leaves you responsible for the other 20%. Why is that a big deal? Well, think of it this way. If you were to go to the hospital, let's say you were in a car accident or you had a heart attack alone, depending if you need surgery, can be a very expensive stay in the hospital. That could range, just to make it simple, we'll say $100,000 easily. And if you are only on original Medicare, that could set you back about $20,000 that you'll be billed. So, is original Medicare enough? Some folks might think it is. Unfortunately, it is not. That is why we have two supplemental options that do help to cover those additional costs, those gaps in Medicare, in original Medicare. I'm going to clear my board here, and we're going to talk about that missing part that we didn't cover quite yet, because that will need its very own information, and that is going to be Part C, Medicare Advantage. Now, there's a few different pros and cons to Medicare Advantage. One con is that you're going to have networks. You're going to have referrals. And you're going to have prior authorizations. That's sometimes a turnoff for people. So that's why there's another option that we can talk about, which we will get to next. But now for the good parts of of Part C Medicare Advantage. Most of these plans, and there's quite a few options available, there's lots of different carriers that offer lots of different plans, and it will all just come down to your region, your area, what's available. A lot of these plans are $0 per month. And what they do is they combine your parts A, B, and D. So rather than paying for a standalone prescription drug plan, you will actually have that incorporated into your Medicare Advantage plan. And a lot of these plans come with supplemental benefits such as vision, hearing, and dental. Now, with that in mind, there's also some advantages to a Medicare Advantage, additional advantages. Some of them come with gym memberships. And some of them come with over-the-counter card allowances. It really just depends on the plan. And to top it off, they typically have many options where, if you're in an HMO, you're going to be stuck a little bit more in the network, but you're going to have higher benefits. If you're in a PPO, you can go outside the network for an additional cost, but your benefits are going to be a little lower. And there are other plans available to help offset the cost of that Part B premium, because you will still have to pay your Part B premium even though you're in a Medicare Advantage plan. That's standard across the board. Everyone pays their $185 per month. The thing about the additional plans that offer you the opportunity to offset that cost, those are usually called give back plans, and those will vary on how much they offer, but definitely worth exploring if you're trying to stick within a budget for your healthcare. They will also come with decreased benefits because they are offsetting the cost of your Part B premium. There are also what's known as Medicare Advantage only plans that do not include any prescription drug coverage. And these are really good for veterans because their veteran benefits typically cover the cost of their prescription drugs. However, that would need to coordinate well with your Medicare Advantage only plan, and some of these typically have the more higher give back options for veterans. There's a lot more we could go into regarding your Part C Medicare Advantage options. However, this is just a very simplified breakdown, a little bit more information about it, and we should move on to the next option, which is going to be, and it does not have its own letter, but it's called Medicare Supplement, or most commonly referred to as Medigap. This is going to be a more expensive option. These plans, you are going to have to maintain your Part B, the monthly MedSup premium, your Part D, and one thing to note about these is that they do not usually cover anything regarding dental, vision, or hearing. So if those things are important to you, you have the option of purchasing a standalone dental or a combined dental, vision, hearing policy. So you have to factor that in too if you were to go to the Medigap route. Now, the great thing about Medicare supplements is that they are accepted anywhere that takes original Medicare. There are quite a few providers that are not going to accept certain Medicare Advantage plans. And if you have a doctor that you're established with and you're very happy with, sometimes that can be a challenge finding a Medicare Advantage plan that will still be covered by your doctor now, or sometimes you have to make a change to a new doctor for that reason. The other great thing about these plans is that they will follow you anywhere, so you have a lot of freedom. You can go out of state, you can go to large cancer clinics such as the Mayo Clinic, and these plans pick up the other 20% of your costs, which is fantastic. I mean, I like to call these plans the prepaid plans, where I like to call Medicare Advantage plans the pay-as-you-go. We, as agents, as brokers, typically are not biased towards one over the other. It really depends on the person and what plan is going to fit them the best. One thing I'd like to point out, though, is that what makes this super confusing for some is that your Medicare parts will be Part A, Part B, Part C, Part D. Your Medicare supplements, these are by private insurance carriers. They are now referred to as plans, and they are Plan A, Plan B, Plan C, all the way through N. For the most part, people who are shopping for a Medicare supplement are going to go with either a Plan G or a Plan N just for the sake of coverage options. And one thing that I like to point out is that Plan G, Plan N, these plans start off being pretty affordable, but they do come at a monthly premium. And as you age, that premium goes up. Each year there's usually a rate increase. It can be anywhere between 6 and 14%. It's very important that you are aware of what company you decide to get your Medigap plan through, because some are more stable than others. But a Plan A through a certain carrier is going to be the exact same Plan A through another carrier. The only difference here is going to be cost. And cost can be anywhere starting off between 80, sometimes as low as 55. I've seen it. It just depends on the plan and the carrier providing the plan. But typically you're going to see a starting point of about $55 to $100 per month. And as you age and the plan ages with you, you will pay more monthly each year over year. And you are going to still need your Part D and pay your Part B premium. And if you need supplemental insurance, ancillary products such as dental, vision, hearing benefits, these are all not included in a MedSup plan or a Medigap plan. The biggest thing, too, is that you have options here in terms of which plan to go with, but in order to make it more affordable, there's something called a high deductible Plan G, which means you pay a high yearly deductible before the plan starts to pay. This can be an affordable option initially, especially if you don't require as much medical services, but as you get older, you tend to need more medical care. So it might not be the best option initially or down the road as it is initially. But here's the problem, is that when you decide to change plans, if you've been on a high deductible plan G for a while and now you suddenly want to go to a regular plan G or a plan N, you're going to have to undergo underwriting. And because these private companies have the option of rejecting your application based on your health or your prescriptions, it can be very tricky to change your plan and pass underwriting. The other thing to note is that if you decide to start off with a Medigap plan, and then you say, hey, I want to take a break and I want to try out a Medicare Advantage plan, and then you realize a few months to a year later down the road that you don't like the Medicare Advantage plan and you want to go back to a Medigap plan, you will have to undergo underwriting. So just something to keep in mind when you're shopping and looking at all your options here. Both plans are extremely different. Some work better for some people and some work better for others. You have to know what your budget is, and you have to know what's important to you. And if you're somebody that likes to stay home and not travel, and you're perfectly fine with seeing the same doctors and staying within the same network, and you're looking out for your budget, a Medicare Advantage plan might be for you. If you like to travel, if you have some pretty extensive medical history in your family that, might be a cause for concern down the future, you might want to consider a Medigap plan because the coverage is very good, and as I said, it's a prepaid plan, which is why you're paying that monthly premium, and where a Medicare Advantage plan are referred to as a pay-as-you-go because you do pay co-payments, co-insurance. But this is just a very simplified breakdown of what the options are. So to make it as simplified as possible, your three options are going to be Original Medicare, with a PDP, prescription drug plan, a Medicare Advantage plan, and a Medigap plan with Original Medicare and a PDP. I hope you found that helpful, and I definitely intend on exploring a lot of these options deeper down the road. But if you're just looking for someone to break it down and let you know what your options are, what the general costs are, this might be the video for you. So please stay tuned because we will be exploring and taking a much deeper dive into Medicare as we go along. Thanks, and have a great day.